And you may recall, I became a whistleblower. I testified before Congress almost 15 years ago when Congress was debating what became the Affordable Care Act. And I warned policymakers about the role that Wall Street plays in our healthcare system. And that's significant because Brian Thompson, the executive at United Healthcare, was there for the company's annual Investor Day.
Let me say this plainly. There is no heroism in what Mangione did. This was a senseless act of violence. It was a cold and calculated crime that stole a life and put New Yorkers at risk. We don't celebrate murders and we don't lionize the killing of anyone.
The mission of this company is truly to make sure that we help the system improve by helping the experience for individuals get better and better. There was nobody who did more to try and advance that mission than Brian Thompson.
Imagine your father has cancer. His doctor orders an MRI.
No, you cannot order this imaging.
Prescribes chemotherapy.
Have you considered this other, less expensive option?
His insurance causes delay after delay.
No, you don't need this surgery.
He dies.
We're fighting with the insurance company over her dialysis to keep her alive.
An injury that required surgery, but he said his insurance company, United Healthcare, would not cover all of it.
And most of it had to have been paid out of pocket, and it was like thousands of dollars, and I had to say no to the surgery amongst, so now I just kind of have to live with it, and I'm just dealing with it now.
A big change in course for Anthem. The insurance giant is reversing its policy to limit anesthesia coverage. The policy would have covered Anthem's plans in Connecticut, New York, and Missouri, and would have limited anesthesia during surgeries and medical procedures.
Blue Cross Blue Shield, the company now forced to hand over a whopping $421 million for years of fraud and abuse of rights.
Just last month, a Senate subcommittee published a report that found the company was using algorithms to consider claims, and it knew it caused the number of its denials to rise.
Blue Cross acted fraudulently by authorizing more than 7,000 surgeries, but only paid about 9% of the cost from the years of 2015 to 2023.
The defense also questioning whether Mangione can get a fair trial after his dramatic arrival in New York on an NYPD helicopter and heavily guarded perp walk. New York City Mayor Eric Adams there waiting.
He was on display for everyone to see in the biggest staged perp walk I've ever seen.
Farther down on the list in the New York statute is that you commit a murder in furtherance of terrorism or an act of terrorism, and that's how Luigi Mangione was charged here.
He states that it's not medically necessary treatment.
But I was really getting very disconcerted with the Wall Street pressure to continue to make more money, what that was doing to how we treated our patients and how we treated doctors. There's an inherent profit motivation to avoid paying claims. And the best ways to do that are delay, deny, and then defend your position on why the denial occurred.
But United Healthcare says its new policy will help them save millions of dollars.
They're hoping this policy will force people to seek medical attention with a primary care physician instead of going to an ER.
According to the policy, United Healthcare would take a closer look at emergency room visits to determine if the visit was in fact a medical emergency. If they determined it to be non-emergent, the visit would either not be covered or there would be limited coverage.
Nearly all doctors surveyed by the American Medical Association said that prior authorization requirements have delayed access to necessary care. 1 in 4 doctors said that prior authorization led to a serious or life-threatening medical issue.
I ordered the test. It was denied by her health insurance company. It was a delay until she actually got the test she needed. It showed a recurrence of cancer, and the patient later died.
Imagine you wake up with blurry vision. Your doctor refers you to a specialist, but your insurance blocks the referral.
Call me to defend why you think this patient needs this.
That causes you to go blind.
We pay higher and higher premiums every single year, but one way or another, insurance companies are devaluing our policies.
You said insurance companies routinely dump policyholders who are less profitable or who get sick as part of their never-ending quest to meeting Wall Street relentless profit expectations. Do you see any changes for the better from back then, about 20 years ago, 2009?
Sadly, no.